I want to welcome Wendi Stott here with Medica. Very happy to again be partnered with Medica. It's been a long relationship. If you recall, Medica was one of the only carriers to stick around in the Nebraska market back when all the carriers pulled. Right now they've got about 82% of the market share. They do have some competition coming in, but Wendy's going to tell us why we want to keep all of our clients with Medica. And we're, again, very excited to have you here. So, Wendi, I'll go ahead and let you start.
Great. Thanks, Nate. Just want to do a audio check that you can hear me fine.
Yep, you're good.
Okay. So anyway, as Nate said, I'm Wendi Stott. I have been with Medica a year ago. June came on to continue the push and the service for the IFB products and roll out our commercial products /January, and so things are moving along, although we know we certainly had some operational difficulties and struggles that you all had to experience this last year. And so hopefully as I get through my presentation, you'll see some enhancements, and we will make life easier for you this year, because we can't do what we do without you, and we need to get those things corrected as we move forward. So Nate, if you want to go to the next screen. I'm going to hit on all of our products and basically the changes of some certain things. I was hoping that I would be able to have the plan grids available, but with the extension of OEP, those will not be done until October 1. So on October 1, you should be able to log into the broker portal and actually see all the plan grids, so you can see the specifics of all of these plans. First thing I'm going to talk about is our Medica Insure plan. Our current membership is just shy of 40,000 members in this plan. We don't have any changes to the service area. We will be eliminating benefit tiering in this Insure plan, so all benefits will pay at tier 1. So that is a bonus for sure. We are removing our bronze share, and the members will be mapped to the bronze share plus plan. Under the Medica Insure plan, we're going to introduce a bronze zero primary plan, a bronze value plan. We also are expanding the offering of the silver share plan to our entire state. So it used to be just certain counties, and that is extended. And then we're going to have a bronze copay that has dental with it. And I will speak to that a few slides down the road as to the dental piece of it. This is just a slide that's just, in my opinion, more of a visual. But again, tier 1 is going to be what we're going to have. We're not going to have tiered benefits. And then those are just some of the major network facilities and providers. So the portfolio, again, I touched on this on the first page, but I think this is a great side-by-side. Those that were adding the silver share plan under the 22 portfolio, we're adding a bronze copay again with the dental, the zero primary care copay under the bronze, and then anybody in the bronze share, as I said, will be mapped to the bronze share plus. Elevate. This plan, again, no service area changes at all. This is just kind of a common thing. The bronze share plan is going to be eliminated, and those folks will be mapped to the bronze share plus. We're also going to put a bronze zero primary copay plan, as well as a bronze value design plan. The one thing I didn't mention on the Elevate is we have about 5,000, little over 5,000 in the current membership. I don't know if that's of any importance to you, but I like to see where all that population falls. And then this is just talking about the network that we use for Elevate, and that is your Methodist and then your UNMC or Nebraska Medicine. The portfolio, again, is that we are moving the bronze share folks over to Share Plus. Again, the zero primary copay and the bronze value. And if it feels like I'm skipping through these kind of quick, it's because I'm just basically repeating myself. Again, October 1st, which is Friday. So if it's not Friday, it better be Monday, but those product grids will be out there so you can go in and look line by line at the various plans. Okay, Medica with CHI. We have membership a little over 26,000. We have expanded into 6 new counties, so that is a wonderful thing. So a little further out west: Custer, Dawson, Greeley, Howard, Sherman, and Valley. And we did not take away any counties, just the expansion of that. The bronze with CHI, again, the bronze share is going away and they'll be mapped to the bronze share plus. We are introducing a bronze 0 primary copay on this one as well. The bronze value, the bronze copay with a dental, and again, I'll go through that. Let me get to another slide. And just to reiterate, here's who is considered our CHI Health Network partners: CHI partners, and then the Boys Town National Research Hospital. And again, the grid. So again, the share is going away, moving those over to the Share Plus, putting in the bronze 0 primary copay plan, a bronze copay plan with the dental, and then there'll be a bronze value plan as well. So now let's talk about that dental plan. So this is on the insurer and then the Medica CHI products. And it's a $400 reimbursement per plan. And there's no dental network. All the member has to do is turn in a itemized receipt to Medica, and we will reimburse that $400 benefit. At a meeting that we held out in Ashland, if any of you attended that, we had someone actually say, well, what about orthodontia? And it's anything that's considered dental work. So it's a $400 reimbursement, no questions asked. You just send in the receipt and check will be cut. So we're kind of excited about that. Any little bit that we can add to these plans to make them richer is certainly a benefit. Okay, so here's some additional good news and some reasons to continue to bring business our way and renew business with us. Our copays are reducing. So our silver copay is being reduced. It was $45 and that's going down to $30. And then on the bronze, it's actually cut in half. So it was $80 and that's going to $40. So we think these are wins all the way across the board. We are, for any of you that do business with the Nebraska Farm Bureau plan, that is sunsetting, and those folks will be mapped to other plans. So if that's something that you work through, you can certainly always reach out to your amazing OCI team for questions on that. Okay, virtual care. So we are offering a $0 virtual care benefit for all of our plan designs. And if you see the slide, you see that it shows AmWell and Virtual Well. And really, for those of you that are doing the majority of your business in Nebraska, it's going to be through AmWell. Virtual is available in other states, but in Nebraska, it's just the AmWell. So it's a $0 copay after deductible for your HSA plans. You don't need to worry about the second bullet. That's regarding Minnesota. And then there's a $0 copay, and it does not apply to telehealth. So it's just for your virtual care only. So we're pretty excited about that. Okay, next page. This one, we've talked about at several of our meetings and haven't got the best feedback on us removing our drug cost tool, but there is some reasoning behind it. We were finding that people were going into the cost tool and pulling up a particular drug, and it would pop up, but if you didn't take it a step further to go to the next page, it might have actually said not covered, where pulling it up made you think it was covered. And in addition, ESI, Express Scripts, was just struggling trying to keep everything current. And so we're going to have these available. It's just going to be a PDF, which is how it is on the commercial side. And you can just simply do Control F, which is find, and type in that drug, and it'll take you right to it. So you don't necessarily have to skim through the whole book to find what you're looking for. Formulary changes, so we are eliminating non-preferred specialty drug tiers on all products. So we'll have 5-tiered drug lists. That's your generic, preferred brand, non-preferred brand, specialty, and then your ACA preventive drugs that are at no cost. Next page, Nate. Thank you. This is just an FYI. So when you get on to looking on the exchange, our name, the way we advertise our plans is going to look different. So in the headline row, it's going to come out and say, just like that example there, bronze copay, and then it'll tell you a little bit about it. So it's just a little bit of a different look, and we wanted to bring that to your attention. Okay, Medica operational updates. So we have several operational updates. So first of all, I was voluntold to be part of a committee for the broker experience team. What I definitely bring to the table is that I was in all of your shoes before joining Medica in June. I was on the broker side for 25 plus years. And so we didn't change the name of customer service or broker service to be called broker experience team just for a name change. We've got some significant changes. We want to be an outlier in the service that we bring, and our systems made it appear last year as though we weren't providing that service. So we've got some changes there as well. But so the team now is going to be called the broker experience team. There's the email address for questions, and you can get there through the portal. There's all your service tools there, but I would say one of the top things for me is that we're going to have extended hours coming soon. And I was told that was October 1st, but I want to be totally transparent that I'm not 100% certain. It could already be, and it may be a few days after October, but we are expanding into Arizona. And so not only did that mean we're doing business in different time zones, we also realize that taking a lunch hour and not answering our phones is not good service. The message itself is just not service friendly. So you will see that piece of it change. In addition to that, when you call in or email the broker experience team, you're now going to be giving a case number. And that case number will be a way to identify a situation through the broker client view, or if you're just going to call back in. Instead of me wanting to know what's going on with my situation, I should be able to see in broker client view an update. I can simply email broker services or call with that case number to see where it's at, versus talking to Wendi one day and 5 days later getting Nate and having to tell my entire story over. And so we're excited about the opportunities that is going to give us. Our broker experience team is also going to have the ability to view billing information. And so in the past, you would be able to call into broker services, and they would only be able to help with certain pieces of information you were needing. Not that they didn't want to help you. These are hardworking, wonderful folks, but their systems, they weren't given access to everything they needed to. And so that will be, that is a much needed change, and we will want your feedback. Hopefully it'll be positive feedback, but with changes, there's always things that don't go right, and we certainly want to know about those. Nate, if you want to go to the next page. So broker client view is a tool that is a dashboard, that is a book of business dashboard. And I know you work with the best FMO, and I can say that because I worked with them on the group side previous to joining Medica, and they are certainly hands-on and proactive into going into their broker client view and pulling down information to let you know on certain things. Unfortunately, it hasn't been what we wanted it to show, would be grace periods and things like that. But this is really what we call the truth of source. And so this tool is being updated to show additional information about your book of business. And to be completely transparent, a lot of the changes that are coming on broker client view is because of your OCI team. They have worked with us and continue to do so to show us what our competitors are showing on their dashboard. And we want to be able to make life easy and have those things transparent to you as well. So if you haven't used the broker service, the broker client view tool, certainly reach out to OCI. Their team knows it inside and out. We are going to have some upcoming training sessions. We can't decide whether we can fit them in to do just a true WebEx and allow questions and answers, because that's really what's needed. But because it's open enrollment, we might just do a few of them that are recorded and get those available through the broker link, so that you at your leisure can have time to go through and take a peek at that. So this is something only that is going to get bigger and better. Nope, you're good, Nate. Thanks. Let's see here. So our Medica broker manual, I was part of the production of the Medica broker manual that we did on the commercial side. And this says newly updated for 2021, and it should say 22. And I believe it already is out on the broker portal, but it's really, if it was the good old days, it'd be a manual that I would have brought to you in a 3-ring binder or given to OCI for them to pass on, and you'd keep it on your bookshelf. But it goes into a lot of detail about contracting, broker tools, commissions, training, certification, all sorts of things. And I actually think it's a great book, just an online book. And I'm dating myself right now explaining that piece to you. So anyway, that is a new tool for IFB. And so hopefully you'll find that of value. Okay, next page, the Marketing Hub. So the Marketing Hub has a different look, as well as everything is getting a different look because we are changing our branding. But you can go out and just simply, once you've logged in, click on your state. And when it comes to sales materials, you can order sales kits, forms, brochures, just all kinds of things under that. There's customizable materials. So if you want to do a postcard or digital ad, those things are out there. Discounted merchandise and free merchandise, and then past updates, alerts that have been archived, and broker updates are all in there, and they're broken out by state, and it's pretty slick. I like the way that our new hub works. Nate, if you want to go on to the next page. So just some additional comments that I wanted to talk through. As I mentioned, we had quite a few snafus last year. And the main one, in my opinion, and I think you're probably are all nodding your heads, would be we run our bills early in the month, but we don't make any, or didn't in the past make any concession for, oh my gosh, this is open enrollment. So I'm going to skip to the third bullet and then back up. So the January bill is not going to run on the 9th or 10th like it normally does. We are going to hold off until December 17th. The hope in that is that we capture all changes that have happened prior to that date, and the bill or the ACH, all of that can reflect what really did happen. An updated APT calc, the plan design that was chosen, etc. Now that that has been extended, we are going to do that again in February. When I did my slide, I said most likely, but I did get information this morning that we will extend the February bill to run late in January. I just don't have that exact date. So how are we going to communicate this to our insured members? So we're going to put a buck slip, a flyer in the November bill, telling them that they're not going to receive their January bill in December till later. If anyone would call into customer service, we're going to have upfront messaging on our phone line. So it's the first thing that they're going to hear is regarding that. So then maybe that if someone's calling in wondering where the heck their bill is, they'll get that answered. We're also going to include that flyer, buck slip, whatever you want to call it. We're going to put it in their renewal. So we're going to touch them 2 times by mail. And then again, it'll be upfront messaging on customer service. We're also going to include that in your broker updates as a reminder, because I realize you deal with more than one carrier, unfortunately. And so we want to make sure that you have a reminder of those, as well as your staff or anyone that may read those. So then back to the top, new ID cards. Every member is going to get a new ID card because our branding changed, as well as our chiropractic care. The claims for that is going to have a change, and so that'll be addressed on the card. But we aren't going to run those or send those cards out until after that December run. I'm not quite sure with the extension of OEP how that's going to work. It could be that ID cards go and then somebody makes a change late and they're going to get a new one after they make a change in February. But we have addressed, I don't know how to, we don't want to hold cards for certain. So we won't make any ID card prints until after that December 17th bill runs. ID cards for new members, we aren't going to hold those. We will obviously set those to print and be mailed as enrollment occurs. Thank you. Oh, nope, go back. Thank you. As far as commission and bonus programs, as of right now, commission and bonus, there will be no changes. I say as of right now because you have an FMO that's working really hard on your behalf, and some sales folks here at Medica that would like to see some maybe enhancements to the bonus program. And we just don't have any further answers at this point other than it's the same, but there will not be any change to commissions. So let's talk a little bit about significant improvements in systems. So last year, first of all, the billing, that was a huge piece of it. And then the other piece of it was we were seeing file feeds come in from the marketplace, and our system wasn't necessarily reading. If we got 3 in one day, we might have just captured the last one. So this season, we now have a team, a small team, but their main focus is through open enrollment is if for every file that comes in, we want eyes on that file to see, yep, we saw that came in, and yes, we processed that file feed. So we had so many last year that were brought to my attention that someone would get terminated, yes, because they changed plans, and then we wouldn't pick up that they did a new enrollment. And that file feed that we received might have been minutes after the first one. And so as you have experienced, some of you, it was a little bit of a cluster. So that in itself has several sets of eyes on it. And then in addition, we have upgraded some internal systems that make the feeding of that data into our system more timely. So it is certainly high on our, it's called our war room. We realize the situations that you were put in, and we know once you've got a member enrolled, we do a great job of taking care of them. We pay our claims, we provide great services, but we can't make getting enrolled and making changes so difficult for all of you. So those these things on this comments page will certainly help in that process. The renewals are going to be mailed starting on the 14th with the intention that your members have their renewals in their home as of 11/1. And again, that initial renewal will have that flyer in that notifying them of the late bill run that will occur. So again, I wish that I had the actual benefit sheets, the grids to go through. The broker brain in me is the one that you educate and you fill out specifics and go through that. So this is just an overview, but you're all intelligent, smart people and sell a lot of business. So I'm confident that you know what to do with those grids. But we appreciate your business. I apologize personally for the frustrations that you all were put through last year. If there's someone out there that wasn't in a frustrated situation, consider yourself lucky. I will tell you, your OCI team works night and day. I probably have text messages that I can share with you that would tell you it's night and day, because they are doing their absolute best to get through some of our muck that we've made. So like I said, with these changes, I think that we're going to have a much more successful open enrollment. And if not, we are committed to taking the next step that we need to. We are in Nebraska to stay, and we are hoping in the very near future that we also take care of the Medicaid business. It was our intention to be able to offer coverage to all Nebraskans, and so we're close. One more comment before I end here is that talk a little bit about our network. And I probably should have included a slide, but that was someone else's presentation earlier this month. But We have notified, and as Midland's Choice, that as of December 31st, midnight, our contract ends with them. That is not a negative, that is an extreme positive. Our networking provider relations team, there's 5 of them on board here locally, have successfully completed contracting with all of the players. There will not be any gaps. If anything, we will probably have a few more additional providers than we had, and those would be your, just your individual providers themselves. But we are full circle, and so what that should say to us and look to us for the future is, with us using our negotiated rates, those should be a reflection down the road in our premiums. As far as premiums go, if you go out to our website or the Department of Insurance website, it says that we're at a 10.1, I think it says, rate increase. That's in aggregate. We have a lot of single digit rate increases that are to be out there, so nothing drastic, but I do know that those rates will be available for you October 1st as well. So with that, I want to thank you for your time and listening to more carrier information. Again, we appreciate your business. You are making us who we are by your partnership and your commitment to help us grow, and we certainly want to help you do the same.
Wendi, thanks so much. I appreciate it. I do have a couple of questions here. Again, as a reminder, on the right-hand side of your GoToWebinar screen, there is a questions panel, so please go ahead and answer those. I've tried to get through a good number of them, but there's some I just want some clarification on. Wendi, is that dental, that $400 reimbursement, is that per member?
Correct.
Or is that per family? That is per member.
Correct.
Okay. As far as coverage in Colorado, with the changes to the network, I know like on your Elevate and CHI, I don't believe Colorado, but on your Insure plan, is there any coverage over in Colorado?
I cannot specifically answer that, but I will find out. What I can tell you is, and Jenny Alms spoke at the 2 broker forums that we had, is we realize those people out west tend to go to Colorado. So if there are any that Jenny needs to specifically work with, our goal is certainly not to cut people at the knees if that's a place that someone is going to out west. So always bring those to OCI, and Nate's team can get those to us. But to answer the question, Colorado in general, I'm going to punt and get back to you on that one.
Yeah, I'm pretty sure. I don't believe there is anymore with that change, but yes, we can circle back on that. So
yep, for sure.
Let's see here. Children's Hospital, I know, will that be covered on the Elevate plan? You didn't have them listed on there, and I believe in the past Elevate.
They are, yes.
Children's? Okay.
They are, yes.
Yep. All right. We already answered Colorado. Has Medica corrected the issue where a client cancels their coverage but is still charged because they are enrolled in an automatic payment and then has to request a refund? Do they still need to also cancel the payment separately?
I believe they need to cancel the payment as well. But I'm going to double check, because with our IT updates, I don't know if that specifically was addressed, but I will find out.
Okay. We're getting a lot of questions on the network. As a reminder, on the Medica Insure network, in the past, Medica had rented the Midland's Choice network. That will be going away here at the end of the year, and Medica is actually building out their own network, which, as Wendi mentioned, that's a great thing because it can lead to bigger discounts at the providers, which should hopefully, reflect in the premium at some point, maybe.
Correct, and for sure. I mean, that's certainly our goal, because Jenny Alm is quite the negotiator. Now, it's going to take us a little bit of time to get through to that point. But, and again, to reiterate, there will not be any gaps. You're not going to see a hospital or a clinic fall off. They have done and will continue to, through the whole process, run report after report comparing the 2. I think it was just last week that Jenny had the Brian committed, and we were still working on UNMC, and those we all had letters of intent. And I just talked to her this morning, and she said the redlining report came back, and out of the 200 and some pages, the only change they had to make was we had a typo and wrote the word "and" twice. So those negotiations are all done, and it's a huge win for that team.
Great. Well, I know I'm super excited about the changes to the billing. I think that's a big must, and I'm glad you guys took, the agents, and we really went to bat for that. We just saw the number of issues, and delaying that billing till after they auto calculate those tax credits, I think will be a great thing for your consumers to hopefully reduce the amount of issues come that first EFT bill pay. So. One of the other things you mentioned was the renewals going out. Just as a reminder, the agents, we will get the Excel file from Medica. Once we get that, we'll separate it out and get that all to you so you guys can field those questions coming in. It'll just be one large Excel file with all of your clients what their updated premiums will be. Again, it might be something I would suggest to send out to your clients that the letter they get is more than likely going to be a wrong premium listed. Just because we don't know where that lowest cost silver will be, especially with 2 new carriers coming in. So those tax credits will need to be recalculated. So might be something to get ahead of when those go out. So outside of that, I don't know if we have any more questions. There was just a question on the Brian network. Again, that's being finalized on the Medicare cost plan. They are effective November 1st. So Brian was added to that network. 11-1 should be added to the rest of their network. I would have I'd be shocked if it didn't happen here in the next day or two to their regular plan. So again, it just sounds like there was a couple of typos, but I know all the discounts and stuff have been approved by Medica and Brian. So
correct. Everything will be good to go 1-1, no doubt.
And Wendi did touch. Sorry, go ahead.
I was gonna say, I will address the Colorado, just verify that, and then find out about that ACH and get back to you, Nate, so you can and I'll try to get it back. So while you're doing your meetings today, maybe you can answer it.
Okay. And real quick, I know Wendi touched on commissions, and Wendi was correct as it stands right now. The commissions are not changing. It's $18 per contract per month here in the state of Nebraska. The bonus program as it stands will be the same. It's 125 minimum members. After that, for the state of Nebraska, it's a $50 per member one-time bonus. I can tell you I have been in talks with Medica to get that hopefully ramped up a little bit more, just knowing what some of the competition is doing. So more on that to come. So we will definitely keep you guys posted as we get the details. With that, I don't see there's any other questions right now. So again, I want to thank Wendi for taking time out of her busy schedule to give us an update on Medica and where they're going to be for the 2022 season. We'll continue to keep you posted as they release their plan grids and anything else that might be pertinent via email or through your OCI agent account.